Now, how you will investigate the patient whom you are suspecting acute pancreatitis. First, we will go for blood test, and the main and the basic is complete blood count, and you will find out that TLC is raised. Then next is amylase and lipase. Both are these pancreatic enzymes, but you should keep in mind that amylase is non-specific. There are many other conditions which can lead to raised amylase levels, but lipase is specific for pancreas. So in case of acute pancreatitis, both these pancreatic enzymes, they will found to be raised. Next is blood glucose. As we have seen that pancreas is having endocrine role, it has role in insulin production. So if it is severely affected, then what will happen? The insulin production is going to diminish and blood glucose will be raised. So blood glucose is important, and it is important prognostic factor because it will indicate severe damage to pancreas. Next is serum calcium. So again, what happens that we have seen that pancreatic enzymes are lipases and they will cause fat digestion. That fat is going to bind with the calcium and it is going to decrease the calcium reabsorption. So serum calcium will be found to be decreased. Both the blood glucose and serum calcium, they are important prognostic factors for acute pancreatitis. So CBC with raised TLC, raised amylase lipase, raised blood glucose and decreased serum calcium. This is the picture that you will find out in the blood test. And next we will move on to the imaging studies. Starting from the basics, you will go for X-ray and it may show ileus. If the patient has developed some abdominal complication, there is some obstruction in the bowel, so there can be a picture of ileus in the X-ray, but that is not very common and mostly we don't go for X-rays. Next is ultrasound. Yes, why you will go for ultrasound? For biliary tree, because we have seen that pancreas is having association with the gallbladder. It is having the main cause, which is gallstones. So to look for the biliary tree obstruction, to look for any stone or any tumor which is causing obstruction up from the upper root, we will go for ultrasound. Then most important, the confirmatory, the diagnostic test for acute pancreatitis is CT scan. And more precisely, if you go for CT scan with contrast, then you can see the complications like pseudocyst, the pancreatic necrosis. You can look these complications and you can treat them if you go for CT scan. So this is the most important and the confirmatory test for acute pancreatitis. And lastly, if the cause is uncertain by all the other investigations of an imaging, you will go for ERCP or MRCP. So among the imaging studies, never forget CT scan. This is the diagnostic test and the confirmatory test for acute pancreatitis, and it is very helpful to look for its complications as well.